Hello, everybody. I'm Dr. Craig Bax. I'm the Chief Medical Officer and founder of the Cure Center for Chronic Disease and Cure Coach Incorporated. And I have the pleasure of just having a discussion today with David Heaps, who is a patient in my practice who has been through our program for, I think, something like 7 or 8 years now.
7 years,
Um,
yeah.
So I thought his story is unique enough from the standpoint of the patient who comes to our program not by being screened for disease and not knowing that they have it and starting from that standpoint, but uh, being told that he has disease and let's just say choosing an alternative route compared to what was offered in the mainstream approach. So David lives in Bonita Springs, Florida. Is that correct?
Actually, Estero, Florida now,
Estero, Florida. In
which
that,
is right next to Bonita Springs.
okay. So, but he used to live
Paradise.
closer to me. So we started out in proximity, and then he became a snowbird, and then a permanent resident of Florida. So, anyway, it's been a great working relationship, and I welcome you, David, and I wonder if you would just maybe start where you started with uh, becoming aware of our program and how you became aware of the need for it, and give us a kind of a brief run through of what happened to you and what's happened
Okay.
since then.
So it was back in the winter slash spring of 2016. And I had taken the winter off from exercise and running and put on probably too many pounds. And went out to start my running again. And I noticed well within 2 minutes that I had very labored breathing and could not catch my breath. And, attributed it to different things, maybe asthma or out of shape. But the problem never went away. I got to the point where I sought medical attention and they did all kinds of tests on me, stress tests. And long story short, I ended up having quite severe coronary artery disease, quite a few blockages, and the recommendation was immediate open heart surgery. Well, coming from the medical field myself, I was in a medical technology. I had set up probably thousands of units of blood for people undergoing anywhere from quadruple to multiple coronary artery bypass surgery. And what I had noted over the years was these same patients came back, not a lifetime later, but maybe 2, 3, 4 years later. So like, I don't think rerouting the plumbing is getting to the cause of the disease. So I told them at the time I was going to hold for now and just do a little research myself. Well, that didn't go well with those around me. They doubted my questioning, and even my wife was a little leery about what I was wanting to do. So I pursued the Esselstyn diet, which is a super low fat diet. And I was on that for maybe about 8 months before I came to see Dr. Bax. And although my blood chemistry numbers improved drastically, I still felt bad. I had never had the screenings that he recommends, and I actually heard about Dr. Bax through a friend. So after going to Dr. Bax, and I think it was probably the spring of 2017, the first time I had come to visit you. Well, since that time, my health has improved. My chemistry numbers have continued to improve, and I'm back. I don't run all the time, but I do a walk run 5 kilometers a day and feel terrific most of the time.
Actually, I'm going to take a peek here at off camera at your tests, I think we have seen, if memory serves me correctly, an improvement in your arterial age, although not dramatically. You start out at age, I think you were 62, 63 when we started with this, and arterial age was 85, and that's something we could go into other videos. But what it means is basically your artery wall was thicker and more inflamed when we looked at it using carotid ultrasound. It's not improved as much as maybe I would like to see, generally speaking, but it's heading in the right direction. But I think more importantly, you had an incident, I think it was about a year ago, where you had some recurring symptoms. Might be useful to maybe talk a little bit about that experience and what we learned from subsequent testing with the cardiologist.
Yes. So it was about a year and a half ago, I started to have breathing issues. I felt like, some parts of my disease maybe not improving as much as I thought I had. And at the same time, I was having a lot of issues with asthma-like symptoms. And since then, I've been diagnosed with, I have a pretty good case of asthma, which contributes to the problem. But anyways, on a trip back to Springfield, actually to see Dr. Bax, I started feeling really bad and ultimately ended up going into the ER. He recommended I go to the ER, and they did another catheter on me just to check my vessels. And one of my blockages had totally disappeared, and the other three had improved, which they couldn't explain, but Dr. Bax could explain. But he never got a call from them, I don't think.
But as I recall, you did get a stent out of that procedure.
I did get a stent, and that was more, in hindsight, I wished I hadn't have, but they were in there and they said, while we're in there, let's put one in the Widowmaker, and that whole term, they should change the name.
Yeah, it's the tool they use. You've heard the expression, if the only tool you have is a hammer, every problem looks like a nail. And there's another expression, maybe a little inside baseball, is called the oculostenotic reflex. And that is oculo, if you see a stenosis, a blockage, the reflex is to put a stent in it. And you did have some symptoms that I think at the time there may have been some justification to think, well, what if that narrowing has something to do with the symptoms you presented with? Although, I think a more rigorous assessment of the situation is everything else, better, maybe this isn't really progressive disease. And I think it kind of reveals the difference in the paradigm of disease that they're using, which is a plumbing paradigm, kind of a rust in the pipes and closing off problem, where we're looking at more what in reality is it's an inflammation paradigm, where that the reason blood vessel walls thicken and plaque forms like pimples and acne, it's because of inflammation. If you can reduce the inflammation, then you can shrink the thickness of the artery wall, which we have done to some extent progressively over time, but at least stop the thickening and stop the formation of new plaque. So it's, and I use the acne analogy, plaque in the artery wall is a lot like a pimple. And it's when pimples rupture that you get a blood clot, and then with the same thing with plaque, so we're trying to prevent plaque pimple formation and plaque pimple rupture, and thus far seems like we've had some success at doing so.
And the one thing that you noted was the flow through that artery before and after the stent. There was, I think you did the review on it, there was basically no change.
Yeah, I'm not going to name names or throw them under the bus, but by the criteria of flow, there was no change. And actually, you had normal flow, adequate flow across that stenosis. So the decision to put the stent in it was not based on typical objective criteria. It was based on something else. I think everybody wants to feel like you helped. And this is what I think they feel they do that helps, even though the evidence increasingly suggests that, you really, for it to be helpful, you need to correlate, symptoms and objective findings that match up with those. And I'm not sure that was the case in your case, but anyway, water over the bridge. You only got one. One of the things it's true. The only stent that I thought was medically necessary that I've had 10 years of patient care doing this was to fix the failure of a stent that had been put in for reasons that were kind of questionable in the first place. Yeah. But nevertheless, I mean, I'm not here to bash anybody, but I think that it's appropriate to do what you did. Courageous it was at the time. I mean, I always have to be aware. I mean, you do have a stubborn streak that once you put your mind to it, that you believe something, you stick with it. But the good news is you're right. So it's good to stick with that conviction. And I think one of the other lessons. I mean, I looked at you when you first came in, and I said, "Boy, you don't look like somebody who has coronary artery disease. You're athletic, you're thin, you run. That's not supposed to happen." But I think we did uncover some root causes that many people who might see this might not even think of as being related. Although when I mentioned, they go like, "Yeah, I do kind of remember hearing about that," and that is oral health and periodontal disease. Right. As I recall, we got you connected with somebody who pays more attention to those conditions as a general health condition, particularly for arterial disease. I don't know if you have any thoughts you want to share about that experience.
No, I mean, I was the typical, brush your teeth, once or twice a day, but had not, I had a lot of cavities over the year. I went to a dentist on a regular basis, but there was some disease in there that I think attributed to a lot of my issues. And once I learned correct dental care, I think those issues are over. And I think the numbers show that because we do an oral DNA test that improved dramatically.
Yeah, and I think one of the things that for the audience, it's important to understand that periodontal disease, like arterial disease, is extremely common. 80% of the population has gingivitis or worse. And so, I mean, in my approach today, compared to even a year or two ago, I would say to generally people, well, this is a common problem. Let's see if you have it. Whereas now when I'm approaching anybody over the age of 40, it's let's prove that you don't have it, because let's assume that guilt to proven innocence, which is sort of the opposite. And that the reason that it is so common, and that's why, arterial disease, heart attack, stroke, kidney failure, dementia are the most common cause for premature death and disability. And I think David's living proof that objectively it doesn't have to be that way, but our goal has to be not just to watch it, manage it, and deal with the late stage complications and rescue you if you can get to the hospital in time with an ambulance. Rather be more proactive, identify it earlier, take the approach that we take with cancer screenings and early intervention and infections, same way. Other than perhaps COVID, where the advice that we were giving turned out to be not only a novel virus but a novel approach. Wait until you get sicker, but that's another topic for another day. I think I don't want this interview to become too long, but I think we've hit the major points, the unique features. Someone who's recommended a standard approach, revascularization, but then knows that the risk of a redo, as they say, is fairly high. Look for somebody to investigate the root causes, dig into those, monitor, and objectively show improvement. And then we have documentation of improvement, as well as the subjective feelings that go along with it. So I want to close perhaps. Now you've had the experience of starting out seeing me here in Springfield when you lived here. Now you live in Florida. Have we dropped? Have we? Are we missing anything from now having that distance between us? In your opinion?
No, it's as they say, seamless. It seems like it's and since that time, my wife has actually joined the program, and I mean, she was arterially a lot healthier than I, but one of the things in her background was her mother had suffered a stroke. I mean, it was in her 80s, but and I think there was some plaque found, but not nowhere near like mine. But she's now on the program, and my feeling is, what he's offered me is something he can offer somebody that's not as advanced as me in the arterial disease. It's not just for those that are way down the road on, clogged arteries. It's for those just starting out that can, keep their arterial age young, at least stabilize it, and hopefully reverse it.
Yeah, I would say with very few exceptions, we're able to stop progression, and our expectation is to see regression, or what I call remission. And that's, I was, somebody quibble about the use of the word cure for chronic disease, but we use that word in the sense that if you can induce a regression to where we have remission and remain in remission long enough, that it isn't coming back, obviously we need to continue to take the measures to control it, which is, lifestyle. We definitely recommend that it's not the salt that's the problem, or cholesterol or fat in the diet. It's really the sweets and the starches and the processed foods and the seed oils. As long as we focus on those lifestyle factors, address targeted nutritional deficiencies with supplements when they're appropriate, and then medications, including statins, but at much lower doses and for a different reason, for their anti-inflammatory effect. We get the results that I'm very happy and proud to say that, 10,000 patient years, I've not had a patient have a stroke or a heart attack during that time. And the one stent I told you about, and the one bypass operation that, because we were monitoring this person with our blood tests, we actually were able to alert him to the fact that he was having silent ischemia, and get him in. And under those circumstances, I mean, he definitely did benefit from having bypass surgery. So it's not, we use all tools available, but the first priority is to stop its progression and avoid the life-changing events and procedures that are generally more dependent upon, by the mainstream approach.
Yeah.
Well, thank you, David. I appreciate the fact that you're willing to share your story, and I think your story will help others see themselves or maybe a loved one, and take the opportunity to intervene at a much earlier stage and avoid the sad stories that we too often read about, sudden death and unanticipated, and who'd have thunk. They didn't seem to be at risk, and so I think this should be very helpful, and I appreciate it.
Well, anytime. I don't mind at all. So I'm glad if I can help someone.
Okay, think of in the coming months, think of us poor souls freezing in the north when you're down there in the sterile.
Yeah.
All right.
All right.
Take care. Bye.
Thanks.